Okay, brilliant. So I'm just going to kick off with a quick introduction, and then Tina is going to talk about some of the key issues with social isolation. I should say that these ideas have been developed with Tina and Samuel, who's a PhD researcher who's been working with us as well. So, and just to introduce myself, Chris Phillipson, I'm at the University of Manchester, and I'm a sociologist, and quite a long time ago, must be at least 30 years ago, I decided, well, older people were a really interesting group to study. Actually, I've been doing it for the last 30 years, and they're still, I find, a very interesting group to study. So I haven't lost my passion and commitment for the subject. And actually, the other interesting thing, and I was thinking about this last night, was that over the whole of those 30-odd years, maybe even more, but let's not get too personal on this occasion. Over the whole of those 30 years, social isolation has been, one of the dominant concerns about issues relating to older people in society. And, it is interesting to reflect on that as to why social isolation has been such a compelling feature about the way we think about later life. And I think that's where a project of this kind, rooted in neighbourhoods and rooted in neighbourhood-based organisations, is a fantastic challenge, because I think, and a fantastic step forward actually, because I think part of our, if you like, failure over those 30-year period to really get to grips with social isolation is because it hasn't actually worked closely with the neighbourhoods within which people live. It's been a very top-down thing. Whereas I think the whole purpose of this programme, to work at a neighbourhood level, to work directly with older people, directly with the organisations they relate to, is the fundamental way forward. These just summarise in 4 bullet points. I think some of the economic and demographic challenges, which of course translate in different ways into your neighbourhoods. And the first bullet point, it is this, I think, a very important issue about unemployment and underemployment affecting those in the 50 to 64 age group in Greater Manchester. And why is that important? Because going back to my very first point, in other words, already in Greater Manchester, people in their 50s are often struggling in terms of either low income or no income. And those are going to be factors that drive difficulties in terms of integrating positively in much later down the line. So I think then that raises the issue, what it is we're talking about with social isolation. And my colleague Tina will now, and you're going to mention the booklet.
Oh, I was going to.
You're going to mention the booklet.
So I am actually quite proud to announce the booklet, which was developed together with Samuel, who has been mentioned, and Chris. And what we tried to do is review some of the key issues that are important to have a kind of theoretical overview about what is social isolation, how does it differ from loneliness, what are the key groups that are facing risks of social isolation, but also what types of interventions have been developed already and what are the success factors. I think key is really for this project is that the focus is on social isolation rather than loneliness. And in the literature, it is clear that social isolation is often defined as an objective lack of social relationships. So it's about the quantity, about a lack, an absence of significant social relationships. Now, why is it important to tackle social isolation? First of all, as an exercise, we have mentioned some figures already, but if we look at the national figures for England and extrapolate these to Greater Manchester, on the basis of estimates that there is about 14% of women, is that correct? No, of men aged 50 and over, and 11% of women aged 50 and over that are socially isolated. Research has also shown that social isolation is linked very strongly to health outcomes, both physical health and mental health outcomes. And there is one research, for example, study that have shown that there's a very strong link between social isolation and mortality. So if you have good social relationships, that study shows, there is a 50% greater chance of survival in comparison to people who have not got sufficient social relationships. That's quite a strong finding. Social isolation not only, of course, has an effect on individuals, but it also has an effect on communities and how neighborhoods work and how services work. So, for example, social isolation is linked to an increased use of health and care services. It is also linked to a decline in solidarity and community bonds in a neighborhood. So it's really important to think about social isolation as having an impact both on an individual level, but also on a community and a structural level. Now, a next question is, of course, who is most at risk of social isolation? And there's a couple of studies that have identified certain risk groups within the older population. So, for example, especially the oldest age category, people who are 75 and over, and we have seen the figures in the beginning, how strongly that's going to increase in the next coming years. So that's certainly an issue that is going to present some challenges. Also, people with psychological vulnerabilities, depression, low self-esteem, seem to be more prone to social isolation. People who spend a lot of time alone, who are divorced, widowed, or live alone, as well as belonging to certain minority groups. And Chris has mentioned a study conducted by Thomas Scharf and colleagues around focusing on social exclusion in deprived areas. And there he found that belonging to certain ethnic minority groups presented particular risks for those groups of people in terms of social isolation. Again, same type of research as Thomas Scharf, but also many others have conducted, have shown that especially in deprived urban areas, the risks of social isolation are much higher. And that's of course related to a number of factors. The lack of access to material resources, but also pressures linked to the environment, such as environmental barriers, lack of opportunities to participate in activities, feelings of unsafety. A number of surveys have shown that there's a really large group of older people who decides not to leave their home after dark at a certain point because of feelings of unsafety, which then again impacts upon people's social relationships, of course. But finally, in terms of the risk factors, I think there's also a number of structural risk factors. Most obvious one is, of course, a context of austerity, budget cuts, but also issues around discrimination. Chris has mentioned ageism, but also racism, other forms of sexism or homophobia. All these types of structural factors can really have an impact on the extent to which people feel socially isolated. So one response, of course, to tackling social isolation is to promote opportunities for social participation. And a lot of the work focusing on social participation amongst older people has shown that social participation amongst older people has a number of positive outcomes in terms of health, well-being, self-esteem, and so on. And if you look at the range of activities that exist in terms of promoting social participation, I think it's really important to see that there is a whole continuum of activities. So if we think about social participation, I think a lot of people will think spontaneously about promoting activities for volunteering or promoting civic engagement. But I think it's really important to see social participation as a broad range of activities. It can be as informal as promoting daily interactions in the neighborhood with neighbors. It can be about creating a more familiar environment where people say hello to each other. So really informal social contacts that are not necessarily related to an organization or a service, to more collective approaches where you involve people in different types of activities through volunteering activities or political engagement. So there is quite a bit of literature on how we can respond to social isolation amongst older people. There are one-to-one interventions, there are group interventions, there are interventions linked or developed from within existing services, and there are wider community development and neighborhood interventions. Most of the literature has focused on the first two, showing that actually if you want to tackle social isolation, it seems to be more effective when you focus on the second, on group interventions, rather than one-to-one interventions. There is one author who has suggested that one-to-one interventions might be more effective if you really want to combat loneliness. But if you want to focus on social isolation, people tend to conclude that group interventions where older people take an active role in designing the intervention, in conducting or organizing or shaping the intervention, and also in evaluating the intervention, are most successful. And finally, I think, and this is of course where I have most experience in terms of practically organizing it, and I think links up very well with some of the projects I heard about so far, is the wider community development and neighborhood interventions. And I was really enthusiastic when I heard the different projects, because there seems to be one communality that most projects really intend to work on the basis of existing assets in the community. And no coincidence, of course, but this is identified as really one of the key success factors in programs, working with existing assets in the communities, but also working with older people themselves to identify those assets. But this is actually the area where there is least evidence existing. So I think as a kind of joint collective effort, helping to build that evidence base on the basis of test approaches can be a real interesting task to achieve. And now Chris has volunteered.
Oh,
have you?
Yeah.
I think so.
Yeah. Well, that was fantastically inspirational, Tina. So banging on about this issue of diversity, and I think just 4 principles here. Reviewing the literature, it is poor in certain areas. There's 1 or 2 interesting studies that have started to come through about the LGBT community, but in relation to social isolation, not terribly strong studies, but I think this idea of safe spaces in relation to social isolation is important, and thinking about how the availability of those within communities for groups who may be subject to, or likely to be subject in many cases, to discrimination of various kinds. I've talked about the issue of dementia, and I think that may be an argument for having a separate, in a way, project discussion sometime about how we kind of manage that, because I think that could be something which could be taken on as an important theme for the project, addressing social isolation amongst people with dementia often living alone, or their carers who are isolated. And their carer, of course, may be an older person struggling to manage. You know, when we think of communities, it's actually the friendship of strangers which is as important as the relationships that you have with people who you're most familiar with. So I think it's about the kindness of strangers, if you like, to use a phrase, and building communities where people feel that the stranger will help them as much as the people that they're in direct contact with. And I think that's still true of many communities, that they have robust helping networks, but they may not be recognized as such. They may need more support. And I think at the end of the day, that communities that have good, strong, natural helping networks are going to be the best communities for preventing social isolation.